Time and time again dentists tell us to floss to protect our teeth. In fact, there is little proof flossing actually works, an investigation has revealed. A review of the latest evidence showed the idea that floss can clean teeth or protect the gums is weak and inconclusive. In fact, other studies show it can actually damage health, causing harmful bacteria to dislodge from in between the teeth and enter into the bloodstream. The U.S. government has recommended flossing in its official guidelines since 1979. The dietary guidelines for Americans must be based on scientific evidence by law. But an investigation by Associated Press, AP, unveiled there was no evidence base for the flossing recommendation. When the government issued its latest dietary guidelines this year, the flossing recommendation had been removed, without notice. In a letter, the government acknowledged the effectiveness of flossing had never been researched as required. The leading dental bodies in Britain, the British Dental Association and the Oral Health Foundation today told Mail Online, they agreed there is no evidence for flossing. Professor Damien Walmsley, scientific advisor to the British Dental Association, said he has always been skeptical. He said, "It's important to tell people to do the basics. Flossing is not part of the basics." He added, "The best way to reduce your risk of tooth decay and gum disease is to brush teeth twice a day with a fluoride toothpaste, see the dentist regularly, cut back on sugar, and consume the occasional sweet treat at meal times only. Small interdental brushes are best for cleaning the area in between the teeth, where there is space to do so. Floss is of little value unless the spaces between your teeth are too tight for the interdental brushes to fit without hurting or causing harm." In light of the revelation, AP journalists looked at the most rigorous research conducted over the past decade on flossing. They focused on 25 studies that comparing the use of a toothbrush with a combination of toothbrushes and floss. The evidence for flossing is weak, very unreliable, of very low quality, and carries a moderate to large potential for bias, they found. The majority of available studies fail to demonstrate that flossing is generally effective in plaque removal, said one review conducted last year. Another 2015 review cites inconsistent weak evidence for flossing and a lack of efficacy. One study review in 2011 did credit floss with a slight reduction in gum inflammation, which can sometimes develop over time into full-fledged gum disease. However, the reviewers ranked the evidence as very unreliable. A commentary in a dental magazine stated any benefit would be so minute it might not be noticed by users. The two leading professional groups, the American Dental Association and the American Academy of Periodontology, for specialists in gum disease and implants, also recommend flossing. They said there were other studies proving flossing prevents buildup of gunk, known as plaque, early gum inflammation called gingivitis, and tooth decay. However, most of these studies used outdated methods or tested few people. Some lasted only 2 weeks, far too brief for a cavity or dental disease to develop. One tested 25 people after only a single use of floss. Such research, like the reviewed studies, focused on warning signs like bleeding and inflammation, barely dealing with gum disease or cavities. Wayne Aldridge, president of the Periodontists Group, acknowledged the weak scientific evidence and the brief duration of many studies. In an interview at his private practice in New Jersey, he said that the impact of floss might be clearer if researchers focused on patients at the highest risk of gum disease, such as diabetics and smokers. Still, he urges his patients to floss to help avoid gum disease. "It's like building a house and not painting two sides of it," he said. "Ultimately those two sides are going to rot away quicker." Mr. Aldridge also said, many people use floss incorrectly, moving it in a sawing motion instead of up and down the sides of the teeth. Pressed about the origins of his organization's endorsement of flossing, he said it may simply have taken the lead from the American Dental Association, ADA. When the ADA was asked for proof of its claim that flossing helps prevent early gum disease and cavities, the group cited the 2011 review and a 2008 two-week study that measured bacteria and did not even consider gum disease. In a later statement to the AP, the ADA said flossing removes plaque, and is proven to help remove debris from between teeth. Studies also show dental floss can occasionally cause harm. Careless flossing can damage gums, teeth and dental work. It can dislodge bad bacteria that invade the bloodstream, and cause dangerous infections, especially in people with weak immunity, according to the medical literature. However, National Institutes of Health dentist Tim Iafala still advised people to floss. "It's low risk, low cost," he said. "We know there's a possibility that it works, so we feel comfortable telling people to go ahead and do it."